All right. Well, I don't want to fault the people that got here on time, so I'm going to start sharing my screen and we'll get started, and then others that join can catch up as we go. I'm Dr. Amy Guzik. I'm one of the stroke neurologists here at Atrium Health Wake Forest Baptist, and I'm also the director of our Comprehensive Stroke Center. And I'm going to be talking today about preventing stroke and what you can do. So let me share my screen here. All right. So the reason this is so important here in North Carolina is that we're part of the stroke belt. And that actually means that we have a 20 to 40% higher risk of stroke and higher risk of death from stroke than other parts of the country. You could see the map on the left. The darker purple are areas with higher risk and higher death rates. And so it's really important in our area to be focused on stroke prevention as much as possible, as well as treating strokes once they happen. There's some good news about stroke risk, as well as some bad news over the years. And so in 2013, stroke fell to the 5th leading cause of death. But there's still an incidence of stroke in about 3% of people, and that's over 20 years old. As we get older, the stroke risk increases. So that's a very broad range there. Women in general have a higher lifetime risk and worse outcomes. And Black and Hispanic patients also have a higher lifetime risk. And unfortunately, African Americans are at a 4 times higher risk of stroke in younger ages, so 40s and 50s, when we hope that the stroke risk can be delayed until 60s, 70s, 80s. Recurrent stroke is still at 3 or 4% per year, which is much lower than it was in the 1980s, 1990s. But we still have a 20% risk of recurrent stroke, a second stroke after a first one at 5 years. And here you could see a more detailed map of North Carolina. You can see where we are is the star, and the darker colors again have a higher risk of death and disability from stroke, a lot of which is kind of out by the coast where traditionally there haven't been a lot of organized stroke systems of care within the hospitals. So what is a stroke? Strokes can either be caused by blood clots or by bleeding into the brain. Ischemic strokes are caused by blood clots in the brain that block the blood flow and prevent tissue from getting the blood that it needs to function. So that tissue dies, and then depending on where in the brain that happens, you're going to have different symptoms that I'll talk about in a minute. Hemorrhagic stroke is the bleeding type of stroke, and that's where one of the blood vessels ruptures or leaks and causes blood in an area of the brain in or around the tissue, and that can cause similar symptoms. Now, we can't tell which type of stroke it is until you get to the hospital. So getting here is really important as quickly as possible. And we have some mnemonics and ways to remember some of the symptoms of stroke, because like I said, where in your brain this happens leads to different symptoms, which means it's not kind of a one size fits all. So the things that we think about for signs of a stroke or any kind of acute onset, really quick start of new weakness, numbness, speech change, vision change, things like that. The things we think about can be summarized by B fast. So B stands for balance, any sudden loss of coordination. E is for eyes, so double vision or changes in your vision that happen all of a sudden is really important to get checked out. F is for face weakness on one side. A is for arm weakness, and that can be arm or leg weakness on one side of the body. S is for speech change, any trouble speaking or understanding words. And T means it's time to call 911. We have treatments for stroke, but we have to give them quickly. So I'm mostly going to focus on clot-based strokes, but the risk factors are very similar for the bleeding type of stroke. But specific to clot-based strokes, what causes these? And it can either be clots from the heart, a narrowing of some of the large blood vessels in your neck, the carotid arteries you may have heard of, or damage to the small vessels deep inside the brain. And that damage can accumulate over time with some of the risk factors, very similar risk factors to things that your doctors are already paying attention to for heart risk and stroke risk. There's a bucket of kind of other causes that are more rare, but are important to consider if this is something that applies to you. So easy clotting, torn blood vessels or trauma, like a car accident or something like that, as well as spasming of the blood vessels. So certain drugs can cause that, supplements, stimulants, and we'll talk a little bit more about those later. So what can we do about it? Like I mentioned, we have treatments, but they're very time sensitive. And what we say in stroke care is time is brain. So the time window for stroke treatment is short, and each minute that stroke care is delayed, you can lose up to 2 million neurons. So it's really important that if any of these symptoms come up, calling 911, getting to the hospital right away, and we have a dedicated team that meets you in the emergency department and make sure that you're getting all the care you need as quickly as possible. There's a few different things that we can do for stroke care. One is a clot buster called TPA, and that breaks up the blood clot if it is a clot-based stroke. There's also a clot retriever, like these pictures at the bottom, that snakes up into the blood vessels, similar to a heart catheterization, if you've ever heard of somebody having that, where the neurosurgeons can snake that catheter up into the blood vessels of your brain, hook onto the blood clot and pull it out and open up that blood vessel and allow the brain tissue to get the blood flow that it needs. There are also reversal agents and blood pressure management for hemorrhagic strokes to try to stop the bleeding, and surgical interventions if needed for any damage to the brain that happens after either of these types of stroke. So what can we do to prevent all of this in the first place? What's the most common modifiable risk factor for stroke? Does anybody want to take a guess? I know there's only a few people on. The most common modifiable risk factor, something that we can change, is high blood pressure. So if you or someone in your family has high blood pressure and is working with your doctor to control it, keep doing what you're doing. That's the most important thing to help prevent stroke. Some other risk factors include high cholesterol, diabetes, smoking, inactivity and obesity, atrial fibrillation, which is an abnormal heart rhythm, and carotid stenosis, which is the narrowing in the blood vessels in your neck that I mentioned earlier. So a lot of these your doctor is already paying attention to, even in your yearly physical, making sure that your blood pressure looks good, your cholesterol is within the range that we want it to be, your blood sugars look good, and talking about smoking and activity and things like that. But I can give you a few more details about working towards goals specific for stroke care. Like I mentioned, atrial fibrillation is an abnormal heart rhythm. It means that the heart doesn't pump smoothly. And when that happens, small blood clots can form. And those clots can go up into your brain and cause stroke. So that's a specific case where sometimes your doctors will recommend a more heavy-duty blood thinner to help prevent those clots from forming and going into your brain. And so talking to your doctor about that's important if you've had any abnormal heart rhythms in the past. And then the carotid stenosis in the blood vessels in your neck, we'll sometimes monitor that and be able to watch to be sure that they're not getting so narrow that it's going to affect blood flow. In women, there's a few extra risks that we have to consider, specifically around some of the hormonal changes that we see surrounding pregnancy, being on birth control, especially at older age, especially if there's other risk factors for clotting and things like that, and then hormonal replacement during menopause and after. We also see a connection between migraine, especially migraine with aura, things like vision changes and other symptoms associated with the migraine that we think are associated with increased risk of stroke. We don't fully understand that link yet, but there's more research going into that. And then I mentioned atrial fibrillation. It's a little bit higher of a risk in women, and that's mostly because women tend to live longer, and so there's longer opportunity for your heart to develop these abnormal rhythms, but it's something to monitor with your doctor. So really the most important thing in prevention is to work with your doctor to manage your health. There's different medications that manage different aspects of the risk of stroke. And so sometimes they may recommend more than one medicine to help reduce your risk of stroke. We talked a little bit about blood thinners. So things like aspirin and clopidogrel, which is also known as Plavix, are blood thinners that might help reduce your risk of stroke or heart attack. More heavy duty blood thinners, things like Coumadin, rivaroxaban, apixaban, those are medications. You may have heard other names for them: warfarin, Xarelto, Eliquis on newer television commercials. Those are the more heavy duty blood thinners that we usually use when your clotting risk is higher or when you have atrial fibrillation. There's cholesterol medications to help lower your cholesterol. Many people have heard of the statin medications, things like Lipitor and Crestor as the brand names. And if you've ever had trouble taking those, talking to your doctor about a different option, there's some newer medications that are also good for lowering your cholesterol. And then blood pressure and diabetes management, like I mentioned. So what can you do at home? You're already seeing your doctor, managing all of these risk factors. What else can you be doing? And a lot of it is things that you probably already know about, as evidenced by this picture of lots of colorful vegetables. So for blood pressure, we know that there are some things that you could do at home to lower your blood pressure, in addition to working with your doctor on medications. So if you lose weight, even 10 pounds can increase or decrease your blood pressure, even up to 5 or 10 points. So if you're right on the border there with your blood pressure and you're not excited about taking medications, losing a couple of pounds can really have just as much of a benefit as a medication. A lower fat diet has been shown to lower blood pressure another 10 or 15 points, and exercise 30 minutes most days of the week can lower your blood pressure another 5 or 10 points. So with all of this together, you could potentially lower your blood pressure 15 to 30 points and not need medication anymore. The DASH diet is something that's more specific, that talks about limitations of salt intake. And it gives you numbers so that when you're looking at the sides of packages, you're able to assess how much salt intake you're having during the day and then make choices to lower that. And this salt is not just table salt. It's not just salt that you're adding to your food at home, but sodium is often used as a preservative, especially in canned foods and frozen foods, and a lot of times in takeout meals, restaurant meals, things like that. So looking at the sodium information on the side of packaging and just getting into the habit of taking a look at that and seeing how much you're eating throughout the day is really important to try to limit that salt intake. For high cholesterol or hyperlipidemia, the things that you can do at home to help decrease that are decreasing the amount of red meat that you're eating, the amount of steak, and then also decreasing the amount of fried foods that you're eating. A lot of people have had some luck with switching from a regular fryer to an air fryer. It's just using less of those high cholesterol oils, but still giving you some of that crunchy taste that you want, but decreasing both of those can decrease your cholesterol. There's also been some evidence that eating oatmeal, if that's something that you like for breakfasts, can help decrease your cholesterol. And we think part of the reason for that is it just kind of binds up all the loose fats in your digestive system and potentially helps reduce that before it's absorbed into your bloodstream. This is that DASH diet I mentioned earlier. And as you look through it, a lot of it is very similar to just kind of common sense things for eating, eating more fruits and vegetables every day, decreasing the amount of sweets that you're eating, decrease the amount of fats and oils that you're eating. And then that really important part that I mentioned about decreasing the sodium in your diet and looking at that. The other great thing about the DASH diet is that there's a lot of information online. And so if you Google it, they will I think the American Heart Association will even send you a free cookbook or free recipes. There's lots of information online to be able to look at that because it's such a kind of well-proven eating plan. The other diet plan or way of eating that's been linked to decreased stroke risk is the Mediterranean diet, which you may have heard of. And this is looking at eating more vegetables, fruits, nuts, whole grains, fish, and using olive oil instead of some of the other fattier oils. And then you can eat some of the other options, but in moderation or rarely, and really try to limit the sweets, processed meats, refined grains, and processed foods. So more whole grains, new like vegetables and fruits, and less of the red meat, sugar, soda, and processed foods. Again, very similar to other healthy eating plans you've heard of. And then for diabetes, really taking control of your blood sugar and making sure that you're not eating sweets, not eating as many carbs, or at least monitoring that with either your doctor or nutritionist if this is something that affects you. So let's talk about some easy first steps. Some people look at these changes and think like, that's a lot of changes compared to how I'm eating now. So what are some easy first steps to make it home, or easy swaps if you've already done the work of making sure that you're eating healthy? Eating at home instead of getting takeout or restaurant meals can often lower your salt intake. Limiting processed foods and watching sodium on labels, like I mentioned. Replacing soda and juice with either water or flavored water, some of those kind of squirt bottle droplets that you can add to your water if you get sick of drinking plain water all day. Avoiding snacking in between meals, or at least plan your snacks and make sure that you have it planned out so that you're not reaching for something that's high in fat or salt when you are hungry in between meals. Trying to avoid red and processed meats, I think that's a big takeaway from this, and switching to fish and chicken instead. Always put vegetables on your plate with a meal, and make sure that you're adding that to your plate. Substitute olive oil for some of the other oils, and like I mentioned, using an air fryer can really help, as can switching to whole grains instead of white breads and white processed grains in your pastas and things like that. Staying active is really important as well as we get older for a wide variety of reasons, not just stroke risk, but also making sure you're staying active, limiting your risk of falls. And so walking at least 3 hours per week can reduce stroke risk. And conventional cardiovascular exercise, which is like moderate intensity, gets your heart rate up. You feel like you're exercising for 30 minutes, 3 to 4 times a week, can really help as well. A lot of the gyms have programs for some of this as well, as I think the Y does as well. Of course, you've probably heard that tobacco use can increase your risk of stroke as well. So we see that smokers have a greater than 2 times risk of stroke. And so this is another way that a big change can happen in your stroke risk with some change at home. Secondhand smoke can also increase your stroke risk up to 30%. So if you're not smoking, but others around you are, encouraging them to quit or at least smoke outside or in a different space than you are in can really help reduce your stroke risk. We also know that more smoking increases your risk. So if you're smoking 2 packs a day, even cutting down to 1 pack a day is going to be a difference. And I know that a lot of people just talk about you need to quit, and that's true, but decreasing will help just as much, or at least will be a start. If you do quit smoking, your risk returns to normal or to that of a non-smoker within 10 years of quitting. So there is kind of a path to normalizing your risk, which is great. And the other thing about North Carolina is that we have some really helpful quit lines. So 1-800-QUIT-NOW, there's available information. And then there's also some information online at this website that I listed here, if you or a loved one is trying to quit. The available medications and patches, gums, things like that are all proven to help as well. So talking to your primary care doctor about the right path for you can really help if you're at a place where you're wanting to decrease or quit smoking. We know less about vaping and e-cigarettes, but we know that it's important to consider that as well. We're still kind of gathering information about the effect on stroke specifically, but there's some early indications that it can affect blood pressure, which increases your stroke risk, and can affect heart risk, which can affect your stroke risk as well. So while it may be a path to quitting in terms of swapping cigarettes for vaping or e-cigarettes, I think the goal still needs to be towards quitting entirely if possible. Some other things to consider in certain circumstances is avoiding or limiting your use of hormonal replacement. If you are using that for perimenopausal symptoms, talking to your doctor about using the lowest dose for the shortest amount of time, and using topical options instead of the systemic or pill-based options, which then affect your whole body and not just local symptoms. You want to avoid medications that spike your blood pressure, and a lot of the cold medicines have components that can increase your blood pressure. So looking for these kind of high BP, HBP options, or asking a local pharmacist at CVS or Walgreens to help you pick a medication that's not going to raise your blood pressure. Illicit drug use can increase stroke risk because of the potential for spasming of the blood vessels, and even things like energy drinks or supplements and stimulants that are over the counter, we've seen increased stroke risk. So I kind of put this all in a bucket of anything that's promising focus, energy, concentration, weight loss, mental clarity is probably too good to be true and probably has some risks, and talking to your doctor about that is really important. Oops. So in summary, I think the really important takeaway point is that time is brain, and getting to the hospital as quickly as possible if you have stroke symptoms is the best way to get the care that you need. In terms of prevention, working with your doctor to reduce stroke risk, and think about some small or big changes that you can make at home to reduce your stroke risk as well. All of that will also help your heart stay healthy and keep you healthy long term. Thanks for listening. I'm going to stop sharing so that if there's any questions, I can